We'll just go live and we'll let people trickle in, but we'll go ahead and start chatting and we can kind of go from there. So, as you know, Dr. Khan, I did this episode. Um, I just put out this episode on autism with Ari Neiman yesterday. Yeah, yesterday. I don't know. Time flies. And but I had done that episode a while back, so it had was sort of in the can before the recent press conference that RFK Jr. and President Trump did. And I toyed with whether I should put in some kind of a note about that specifically, and ended up not doing it because the episode isn't sort of primarily about that stuff. We touch on it, as you know, and thank you for listening to the episode
Yeah.
on some of that a little bit, primarily about sort of how autistic parents of autistic children in particular, can get sort of caught up in these kinds of things and um, and kind of get preyed on by people selling various wild cures and so on. But I talked to you a little bit specifically about that press release and also the science around, because I think there's a lot of confusion now, and maybe there's some confusion before, but I think there might be some more confusion now around, the realities of acetaminophen. And I may not be pronouncing it quite right. I know
No, it's
President
perfect.
very well. And particularly pregnancy and also children. I think there was another scary part of that kind of implied you shouldn't give children, Tylenol or acetaminophen, and I think that's particularly scary. But also, we know fevers, and I'm gonna let you do the science of this and tell me if I got it wrong, but I think we pretty much know fevers have potential to cause various issues during pregnancy, and so you're kinda caught in a hard place if you're not allowed to use suddenly you can't use Tylenol. And again, would ask people to, of course, speak to their doctor about this and be advised. But yeah, so help us on that front. And then also, I think there's some dangers telling parents that they can't give their kids Tylenol.
Yeah, I mean, there's so much there. First, the press release was a performance. That's the vibe that it had. President Trump didn't only insinuate, don't give your kids Tylenol. He outright said, don't give your children Tylenol. He also said, if you're pregnant, don't take Tylenol. Instead, you should tough it out. So, in between these really bold untruths, there was a, caveat said by all of them who were speaking: Trump, Kennedy, Oz, McCary, and Bhattacharya, recognizing that Tylenol or acetaminophen, which is the active ingredient in Tylenol, which you pronounced better than the person telling us not to take it did, also known as paracetamol around the world, is the safest option to use for pain relief and fever reduction during pregnancy. The alternative is typically the over-the-counter category of medications called NSAIDs, non-steroidal anti-inflammatory drugs. That's ibuprofen, um, uh, and there are a few others that you could get by prescription whose names are escaping me right now. But that category of medication, we'll just say ibuprofen, also known as Advil here in the States, is actually really dangerous, not only for the fetus when you're taking the medication as a pregnant person, because it disrupts the literal fetal blood circulation and can cause fetal demise or fetal death. In children younger than 6 months, that category of medications can also do irreparable harm because little kids' kidneys can't clear it. And so, what I was really shocked by in this time where we're getting less and less shocked by shocking things is this, outright black box warning on acetaminophen, which is known to be a safe drug, and by default pointing people towards a more dangerous alternative. There's lack of precision in scientific speak. I hate using the word unprecedented because we keep using it. That's not what science is about. The scientific method is about precision, and it's about building on what we have already learned. So, we can talk about the studies that they quoted in this new autism fact sheet and autism um, project that RFK is leading, but those are older studies, and there are newer, more improved studies, particularly the one that came out of Sweden in 2024 that try to look into the issues with those previous studies and clarify, is this correlation really a cause? And the answer was our research showed it isn't. And yet we're giving guidelines from the highest levels of government health that is wrong. And I think it only continues to reduce the trust that the public has and increases the confusion that we all have. What are we supposed to do?
Yeah, there's so many things I wanna make sure we try to get in here, and there's so many directions I could go right now, but yeah, I definitely don't wanna miss some of the details about that, there has been known, sort of this, uh, um, correlation between this was noticed a while back, this between a
Yeah.
city and ASD or and so what does a real scientist do when they see a correlation, right? They don't go, "Oh, well, that's what's causing it." They go, "Hey, there might be something," or they also don't go, "Well, let's reject that because we don't like
Yeah.
that result," right? Or that we don't like that data point. What they do is they go look at it. They look at it in more detail and say, Is there a reason? Could this be something? Let's look into it," right? And that's kind of what has been done. So I do want to come back to that study a little bit and talk about that. I kind of wanted to get that point out there. One other one is that my understanding, you can kind of correct me on this, is that acetaminophen or Tylenol is the only drug that's really approved in any way for pregnant women or
Yeah.
fevers. It's not like it's recommended, and but it's also recommended to take it at like the minimum dose, if I understand right, for the shortest amount of time, which is almost, in some ways, what got said by a lot, as you said, by a lot of the speakers, if you unwrap it all. But for a lot of people in that talk, the only thing they might ever hear is "Don't take Tylenol."
That is what a lot of people heard. Don't, because it was actually said, don't take Tylenol, dot, 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 unless it's medically necessary. People aren't using Tylenol recreationally.
Right? Not
That's, and we know that pain and fever in a pregnant woman impacts not only her health, but also fetal development. And
right.
so, what are you really, I'm
That's a
sorry.
causal effect, right? That one we have a known causal effect.
Yes, we absolutely do. That is something that we know and that we continue to demonstrate. Like, that's what the research continues to demonstrate. Because it's not like we learn something and say that's it. There are so many, you could say, redundant research papers on the same topic because that's part of the scientific method. You've proven something, now you have to repeat that experiment to make sure that the results stay consistent. And if there is an inconsistency, then you investigate that. So yes, Tylenol is I'm sorry, fever and pain is dangerous for the pregnant person, it's dangerous for the fetus, it's dangerous for a baby, it's dangerous for an infant. And Tylenol or acetaminophen is the safest option for pregnant women and for children under the age of 6 months.
Yeah, and I wanna make sure we reiterate the idea that, like, I think Trump also kind of hinted that take an alternative is like, there is no good
There
alternative.
is no alternative.
And if you try, like you say, the one that people would usually use, the ibuprofen, Advil kind of idea, that's also got known causal effect, right? That's
Yeah,
not
you could
theoretical.
have a miscarriage. And ibuprofen is available over the counter just like Tylenol is. Um, Maybe the one thing that is a saving grace is that because he couldn't pronounce acetaminophen and just kept repeating Tylenol, a lot of people are picking up acetaminophen and not Tylenol or not the brand name, basically the off label
Oh,
of
I
the same
see. Yeah.
medication. Yeah. So, I'm hoping for that, but I can imagine that there is someone who's gonna take ibuprofen because the president of the United States told them not to take acetaminophen. Um, There was another I mean, there it like you said, there's so much here, and I like, my thoughts are
Well,
in
I
a
also
million different
also
places.
rate that in children as well, Advil is not an option, right? That you have to be a
Yeah.
certain or
You have
that's
to be over 6 months because,
okay.
ibuprofen is excreted in the kidneys and also has an impact on kidneys. Even adults who have renal disease, kidney disease, who are on dialysis are advised not to take that category of medication because it impacts the kidney, and kids under the age of 6 months can't metabolize that drug. It also thins your blood. It's this in the same category sort of as aspirin. It thins your blood, and so it's really not an option. So I worry for parents. I worry for people who are pregnant because it's already such a stressful time, and literally like your frontal lobe is consumed with so much else that it's hard to tease out all of these details. So these leaders, these public health leaders, can say one message really really loudly. That's the thing people are going to remember, even if they say the details parenthetically.
Right. Yeah, exactly, and, another thing, a piece of that, conference that really bothered me, some of the message that I heard that ties right back into the autism episode that I did, where there was sort of this history of kind of blaming parents in the early
Mhm.
days. Um, they were the idea of these refrigerator moms, and they weren't warm enough with their children, and that's why they ended up with children with autism or with autistic kids, and and so this is all like bringing that back. That now it's your fault these kids you know are like this, and I want to talk and an RFK seems to have this idea, and we talked about this in the episode as well, that these kids were normal or neurotypical, and then suddenly something happened at the age of
Mhm.
2. As far as I understand it, that is absolutely not what we think or what we see.
Yeah, and I think you had some really nice audio from Peter Hotez, who's a vaccine expert and an epidemiologist, reiterating this and clarifying this, that it is most likely, certainly, children can have, any of us can have uh, a uh, a trauma, like a anoxic brain injury, some side effect to a medication that can alter the rest our health for the rest of our lives. But for the most part, people who have autism had it at birth. It was interesting in that episode how Ari talked about this category of developmental disorders versus intellectual disability or an intellectual disorder, and how we're when we think about autism as a developmental disability, and when we hear RFK and others say the diagnosis has increased thousands of percentages, um, we're learning to diagnose autism at a younger and younger age. And pediatricians are focusing and including an evaluation for autism at these really early PEDS visits. So it is true that there's probably more kids diagnosed at the age of 2 with a concern for autism spectrum disorder, and then get worked up even more for it and get accommodations if they need it, than there were in the past. And that's an improvement in medicine. That's not sudden increase in the numbers of autism. That is that we're better at recognizing autism.
Well, I understand that there very well could be an increase, and I think again, overall too, right? I mean, both things can be true.
Sure.
And, and again, I sort of come back to scientists in that case. And, you know, some of these things are sort of like, like sometimes I feel like RFK Jr. in particular sometimes presents this stuff as though he's discovered this new thing. Nobody's
Yeah.
known, people have known about this Tylenol correlation for a long time. And that's why they spent time looking at it. Likewise, people are looking at like this, are concerned about this idea that there's potentially an increase, and they're looking at that as well and trying to figure out what might be happening there. And sometimes he presents this like he's got this secret, and
Mhm.
nobody's. not nobody's taking a look at this, and it's I think that it's kind of a myth there as well.
Yeah, and this whole idea of, like, we're pulling back the curtain. This was hidden from you. The very mysterious they didn't want you to know, but we're gonna show you the truth. That's really dangerous and just chips away at, the public's trust of health institutions. And by and large, these researchers, epidemiologists, and people who work in both, developmental disorders and infectious disease are they're basically nerds with good intentions. They're doing a lot of hard work, and they are not able to share um, their version of the story and their intentions because, as you know, a lot of federal employees are under really, really strict gag orders. And so what do? There is certainly, like, medicine is not perfect, science is not perfect, government bureaucracy is certainly not perfect. But what this press conference made me concerned about was that the method is being disrupted in a very detrimental way. And I think this goes along with the narrative of the Trump administration of wearing the badge of disruptor um, on them as a badge of honor, that we're going to shake things up and that's a good thing. I mean, it's chaotic right now. It feels really chaotic and it has real implications in people's safety. We can talk about the whole misogyny of it all too, because I think Hegseth's recent performance too tied into it, reminded me of this HHS press conference.
Oh yeah, I didn't even really think about that, but that's true. That was kind of played into it as well, and I think you get that right in the way that they present. Like you were saying before, pregnancy is already really stressful. Moms are already under a huge amount of stress, and then you're going to sort of throw this stuff on them.
Mhm. Without any alternative. So this idea that's so misogynistic that we've talked about refrigerator moms that basically, moms are icy, they're emotionally detached from their children, and then bad things happen. You're a bad mom. That's why your kid isn't normal. That's essentially the message. Be a better mom and be stronger. So when I heard President Trump say, tough it out, that was the advice he gave pregnant people. Don't take Tylenol, just tough it out. It's completely impractical. Actually, one of the, quote unquote studies that this new autism initiative quotes to prove that there's this correlation or cause between of link between Tylenol and autism spectrum disorders was a the Boston study, which tested basically umbilical cord blood, and every single baby they tested had active acetaminophen detectable, because it is the most commonly used medication, or one of the most commonly used medications during pregnancy. Pregnancy is painful. People get fevers. People who are pregnant get sick, and it needs to be treated. And that is a risk benefit versus leaving a fever and pain untreated. But so telling women just go ahead and tough it out isn't practical. People don't take Tylenol recreationally. 70% of women work when they're pregnant. Many, many women already have children and households to take care of. How are you expecting us to do all of this if we are febrile and have pain? It is too much to ask. And it does remind me of this morality that we're seeing in the Trump administration of, like, you need to be a stronger, better person. Dr. Oz, when he was confirmed, said it is your moral obligation to be a healthy person. It is your patriotic duty to not use as many medications. Trump said, tough it out to women. And then Pete Hegseth basically spent a lot of that speech demeaning women and associating them with weakness. And that's what we, as tough soldiers and warriors, shouldn't be. We shouldn't be women. So that makes me really, really sad. And it's, blatantly not true because women have played such an important role in every civilization, including the US military.
Right. Yeah. I mean, certainly in my experience professionally, it's like every team that has, women involved gets better, right? So
Mhm.
it's like, I think that's pretty easy to see sort of intuitively there. But I know data also backs that up.
Yeah.
Yeah, it was definitely frustrating, and I think, as you said, it's really trying to undermine the whole idea of that. It's trying to create this idea. This is very much the RFK side, particularly of this sort of science, like you said, is being secretive, and it's a plot to keep the real data from you, and yeah, and that idea, and this is becoming popularized too. This idea that yeah, every any prescription you have is some kind of a moral flaw.
Mhm. Yeah. Um, I don't know, we have to be a little bit more calculating when it comes to science, and we really need to reduce this judgment on medications. You know, we could on a have a whole conversation about this, like, natural versus prescription. A lot of the active ingredients we have in prescriptions that are help many, many people were first identified in plants. And so, what you do to improve the access to this active and powerful ingredient is you quality control it, you reproduce it at scale, and you make sure it's available and safe for people to use. And then you put in some you study the amounts that people need, and then you make recommendations on this is the active ingredient. Aspirin, the active ingredient comes from the bark of a tree. And you don't want to take too much, just like you don't want to chew too much on that bark of that tree. So it is, but we're seeing a lot of people say, like, I don't take medications. I only use natural remedies. That's great for you, but it doesn't mean that you're a better person. And, I hate to see years and decades of research get dismissed and these powerful treatments get, binned because we have this false idea that being good and being a good American is being an American who has absolutely no problems physically.
You're right, and for some people, these drugs, are not taking the drugs is life-threatening,
Mhm.
and you may not and it may not be the kind of drug where you're gonna notice it on day 1 or something, but, if you sort of stop taking your blood thinners and you've got certain conditions, your chance of a stroke might go way up, um,
That's right.
and, to tell people they're morally bad for doing that, yeah, it is pretty unfortunate. In a lot of ways, or in some ways at least, I think, RFK and some of the folks around him, do a service in the sense of raising awareness of certain things that may be out there. It's when they start offering the solutions that's not based on any kind of underlying evidence is when it kinda goes south. And like you say, a big concern that I have is, yeah, spreading really dangerous stuff, at the high level. That's what's scary because, like I say, no one's gonna hear the parts in the parentheses, right? They're just
Right.
gonna the other part, and that's for a lot of people, that's all they'll hear, and that's pretty scary when it's actually dangerous stuff. And then this bigger one that you're referencing of, just kind of breaking down the whole process and, and like you said before, of science and this whole approach, and like you said before, like all these things can probably use some improvement, but you don't blow it up.
Yeah. I mean, that's goes against the scientific method of what do you assess what you know, ask how I know that, what is left to know, what's questionable, and how do we develop a system or a study that can overcome and answer these new questions? And then you take the next step. It takes a lot of time, it takes a lot of effort, but boy, I would love to see us as a country invest time in that thoughtful approach and then be able to implement really broad and probably really challenging changes to the structure of a lot of these institutions. But then at least we know it's thought through and we know what the goal is. Right now, it just feels like break things and get attention. I don't know. I don't know what your thoughts are. Why do you think that RFK made this announcement when it doesn't seem to jive with research?
Well, I would say my first reaction would be a couple of reasons. One is that, he sort of I think he came in and pitched that he was gonna have answers to things like that. It's the answers are there, the science has been holding him back. So he had to sort of come out with I think he had felt like he kinda had to come out with something that he could say, "Here's one of the things that science has been hiding from you." Because I think that's a bit of how he's pitched himself,
Mhm.
to the administration itself. And so I think that's one aspect, and he's just on a but he's and I have a pretty, cynical view, so I feel like he's just deeply connected to this alternative medicine world and kind of has he's been a lawyer who makes money from, suing people, and one of these latest ones that talking about making vaccine companies now liable for various things,
Yeah,
is right up his alley, right? I mean, that's right up his I think his law firm will very quick
that's what they
very
were pushing for to
benefit
start with.
that, right?
Mhm.
So I'm pretty cynical about that side of it.
Yeah, I worry that that's true, and, to point up another parallel to another really complex disease that's close to my heart, you know that I don't practice medicine right now. And for the last few years, because I got so sick after my COVID infection with long COVID, that I've been navigating my, journey, I guess, back to being able to stay upright all day. Um, Long COVID is a really complex condition that presents in a lot of different ways, similar to autism spectrum disorder. It is also one that we know a little bit about and we don't know enough about. We also don't have a single treatment that will be effective for everyone. Like autism, we're not sure what exactly the underlying mechanism is, except to say that something was triggered, the virus triggered something in the body to cause this end result. And right now, we're in the midst of the long COVID communities in the midst of a lot of fear of funding and the direction of research. A few weeks ago, before this autism announcement, the Foundations for the National Institute of Health held a workshop that was open to the public, explaining their long thought process into which targets they're going to fund and give priority to, what treatment options they're going to study, and they explained why. And there even that was not perfect, but at least there were some people in the room. There was a lot of patient voices and people with lived experience, caregivers, care partners. Um, and the NIH has been open to receiving that feedback. And it takes time to collect all that information. It takes time to sift through a bunch of treatment options. It takes a lot of thought to determine where are we going to invest our limited funding. And the same questions are asked with autism research. So that workshop was positive, but it was also imperfect. A few weeks later, RFK Jr. held a roundtable on long COVID, invited quite a few of the sort of heavy hitters, scientists, both within the federal research paradigm and outside, to discuss what more can we do to find an answer for long COVID. I think it sounds like he has a family member who is struggling with long COVID too. But he also showed some real interest in these like really low evidence treatments like hyperbaric oxygen therapy, which I have learned parents use for autism. There was a child, unfortunately, a few months ago, or at least I read it recently, It must have been within the last year. A little 5-year-old died from a complication of hyperbaric oxygen therapy. My assumption as a physician, when I think of hyperbaric oxygen, I think of wounds that won't heal. And I thought this poor kid probably has some wound and he needed it. They paid for it electively, presumably to treat hyperactivity disorder. And so and then had a, horrible outcome that had nothing to do with his autism, but, or ADHD. Um, but when we're paying attention to to some fringe theories and ignoring like these foundations of science that we've worked really hard to get to. We are making headway in long COVID of understanding what pathways are triggered that cause certain symptoms in long COVID. We have similar, evidence in autism that there is a genetic variability. There's probably some exposure that increases the risk. And yet we're talking about Tylenol. And I worry that in the long COVID space that has similarly complex disease, similarly limited funding in this pie, that RFK is going to say, okay, that's great that you guys studied all of that. We're going to, let's invest a lot of money in hyperbaric oxygen therapy. That's what I'm going to say is the solution.
Mhm.
And
Right.
it's really scary.
Yeah, I mean, I think there are a lot of parallels in some ways. And in general, I would say, like, I get it for both parents, looking for answers. Um, that's a tough situation for any parent, especially if people are telling you it's your fault in some way, or you can feel that way, whether people tell you that or not. And
Mhm.
I think there's some things that you can be frustrated. We talked about this when I had you on the show about, any chronic illness you can have you can be frustrated by it when doctors often some turn it back on you. You're think it's in your head, this kind of stuff. um and because I think the doctors get frustrated too, because they live in a world where they're supposed to be a magician and have the answer, and when they don't have it, I think they get frustrated too. But so I kind of see why people start looking at a lot of these alternative things. But when you have, like you say, at the highest levels, um places where they're just absolutely ignoring the evidence that undermines their theses. It's at the highest levels. It's like now you've like legitimized this whole universe of of whack job ideas.
Yeah. And like you said, like parents are trying to do their best. People with conditions are trying to do their best. Nobody here is suffering from laziness.
Right.
We all want to get better. We all want to be able to function. And what a huge responsibility to have a child who you think is suffering or a child who you're worried about their ability to function in this world. So yeah, you're going to try everything you can do. And that's why I think it is so irresponsible to give credence to treatments or give advice that is not based in the highest levels of science that we have so far. That lack of responsibility, I guess, or, this cowboy cavalier attitude, it's, it's It's so harmful and it impacts much more than autism. I'm sure everybody listening can understand. I don't know which vaccine I'm supposed to get and when. I don't know what medication I'm supposed to take when. Even if you're a healthy person and if you have like a significant health issue, it's even harder to tease out these decisions, and the the impact is much higher. Like the risks are much higher for not do anything. You're desperate for a solution. Um, that's, I think, what really broke my heart with this press conference, to just hear the president give medical advice that was so imprecise and so bad, so bad and so wrong.
Yeah. Something else you said in your episode with Dr. Berghardt
Burger. Mhm.
that I thought was really important is like, we you hear people always say, well, make sure you check with your doctor, see what your doctor says. And you're kind of talking about how, well, okay, but what about when your doctor's getting this pressure from
Yeah.
HHS or CDC that here's what the treatment should look like. Can they give you that good information still?
Yeah, I mean, one of the aspects of this new push is that the Department of Health and Human Services is sending a warning to all physicians, telling them that acetaminophen is dangerous in pregnancy. And I'm sure the letter they're going to send or the message they're going to send has all of the caveats listed in it. Still, it's a memo from the federal government. And that feels very much like a threat. And there are plenty of physicians who may believe that acetaminophen causes autism or may be a big fan of RFK. I certainly have been met with some wild theories told to my face by my own doctors about long COVID. Um, Sometimes I'll just say, okay, thank you. And then I leave and I don't come back because I have a lot of background in how to make medical decisions. Not everybody does. And I worry that just like we've been seeing a lot of um, distress among physicians when they're making decisions for people who need abortion care in certain states, I'm worried that we're going to see a lot of distress among physicians advising on how to advise their pregnant patients. So yeah, I keep hearing this, like, remember to just talk to your doctor. Well, like, your doctor's getting a message telling them not to prescribe or not to recommend Tylenol. So what are we going to do? That's an added layer of potential harm.
Yeah, and that also makes me think about what are your thoughts on some of these ideas that some of these states are going to try to kind of create their own mini CDC kind of thing, with the
Yeah.
federal government still pushing down these kind of mandates and ideas. Can something like that still be effective?
I don't know. I feel like we're on here in California, we're in our own little island. And anytime there's an issue at the federal level, I look for the details of like, well, what is California doing? And how is this actually going to impact us? California, Oregon, Washington, and a couple of other states on the East Coast have formed another collaborative similar to when, in 2020 time for COVID vaccines, saying that we're going to make our own recommendations. Um, I think it's not ideal. I appreciate that I live somewhere where I might have some more options, but we can't, this is not tenable for the long term. And science doesn't work in one place differently than another place. The laws of physics still apply. So I guess I'm on the one hand happy that at least there's some pushback. And on the other hand, I'm still really concerned that it continues to erode trust in public health. Like, you know, people saying, I'm not going to do that because, there's plenty of people in California who are not liberal or Democrats, by any means. So, like, if Newsom's saying I'm going to do it, I'm not going to do it.
Right.
We can't make science so political.
Yeah, and that's part of the problem is that it kind of has become so. And I guess you could argue academia brought this on themselves a little bit, but I mean, this is just taking things way too far in the other direction. Well, I really appreciate you making the time for us. Is there anything else you think kind of as a safety factor that we should know?
Um, I still think it's good to talk to your doctor if you have specific questions. I think it's really going to be important that we develop really strong relationships with our healthcare providers. And if you can put in some effort into saying, maybe you don't have a primary care doctor or a primary care provider because you can have a nurse practitioner who's your primary care provider. Maybe you don't have one yet and you don't anticipate you'll need one. it might be worthwhile right now to do a little bit of your own research, talk to your friends, who is somebody good in your community that you could potentially trust and build a relationship with. Because ultimately, doctors, it takes us a really long time to get here. Certainly, there's like financial incentive, but the payoff in the long term financially is not what motivates us to become physicians, certainly not primary care doctors or pediatricians. We are here to help people. I always, even on my hardest days, I went home saying to myself, at least I wasn't pushing papers. I was touching somebody's life. Find someone who you trust and build a relationship with that person so you have a source to go to that might be able to lead you in the right direction.
Yeah, that's great advice. I saw a stat recently, I can't remember the number, but I was quite surprised how what percentage of people do not have any kind of, primary care.
Yeah. Yep. And you don't need it until you need it. So while you're healthy, it's actually a pretty good time to decide who you're going to go to. Make an appointment, even if it's just to say hi. Hi, my name is so and so. What's your story? They're just another person, and they could be a real ally for you, um, and someone whose brain that you really want to pick.
Yeah, it's interesting that that reminds me of when we had our episode, you talked about, the challenges of being a physician and some of that. And I actually now, every time I see my primary doctor, I always ask, "How are you doing?" And they're very shocked by it, but they actually answer it. Like they'll go into all kinds of stuff going on, and I'll just be a sounding board for a little while.
I actually do the same thing with mine. Like, what's the newest? What's the latest? And there's always something new. Healthcare workers are struggling, teachers are struggling too, and now, government workers are struggling as well, but, there's good people. People go into this for the right reason, so go and say hi to your local doctor.
100%. All right, well, Dr. Zeest, thank you so much for making time. It was great seeing you.
Thank
Well,
thank you.
take care.
Bye.
Bye-bye.